We started to deploy MedMinder for some of our clients that were medication issue clients, I guess is the nicest way of putting it. And typically these would be people such as Parkinson's clients where the timing of the medication was critically important. If they missed it by an hour or 2 hours, they would almost spin out of control. Starting about a month or two ago, we started rolling the boxes out to some of those clients and seeing what the impact on them is. And the initial results are very, very encouraging. First of all, we see it takes about 3 to 4 days for the clients to start to comply with the box, I guess was the best way of putting it. They don't immediately understand how it works, but once they do, they really start to, it almost like it takes a stress factor away from them, because they're not trying to think, well, do I need to remember a pill now, because they know the box is going to tell them that they need to remember the pill. And so after a few days, that stress factor has gone away. What we're seeing is, as a result of that, our caregivers are reporting back to us that the levels of confusion that the clients are seeing is much lower. We have this one particular client where our caregiver would go in there at 11 in the morning. They routinely would have missed their 9 o'clock pills, so the client was very confused, almost staggering around the apartment, not knowing what was going on. And by now enforcing that 9 o'clock pill with the pill box, we're not seeing that happening. This means a better experience for our caregiver. It means a much lower fall risk, which is a huge concern for us. If somebody's got vertigo or because they've doubled up pills and are staggering around, the next thing that's going to happen is they're going to fall, they're going to break something, and that's very bad news. So this helps eliminate that kind of thing from happening. If I was looking for a client that this would be good for, it's somebody who's taking at least a couple of times a day a number, and by number I would say maybe 3 or more types of pills during the day, and understands that they need to be taking the pills. That's a big factor. If somebody has dementia or gets confused, this is probably not the best solution for that, and the question really, should they even be living alone? But if they can understand the need to take the pills, then this product is perfect for meeting that type of need. And it does lower their stress level. I come back to that again because I'm seeing it with our early adopter clients. The fact that they don't have to remember to take a pill at 9 or noon or 4 or 9 p.m. or whatever lowers their stress. Well, I think the data we get from the web page is extremely useful both for us and also for the geriatric care managers that are involved with it. We can go on in the morning and the evening and quickly scan through our clients and see which ones have had some kind of event that needs some kind of response from us. Typically that response is going to be to call the family and let them know that we have a medication issue going on, or if the geriatric care manager is involved, the geriatric care manager can spearhead that type of thing. But by having that data there, one of the things that it does is it eliminates the, what are you talking about? I took the pills on time, or what are you talking about? I didn't double it up. We can show a printout that says, oh yes you did, or no you didn't take them on time, or you missed it. And what this has done in the early going is it's increased the number of service hours that we're being used for. That wasn't exactly what we were expecting to happen, but what happens is that the family sees that there is an issue with the 9 o'clock in the morning or 9 o'clock in the evening pill. They're going to be much more willing to accept that a caregiver needs to be in there to help drive that process. So where you might think it will eliminate the need to have a caregiver, in some cases, not all, but some cases, it's going to improve the level of care by getting a caregiver in there when you need it, or conversely, it might eliminate the need for a caregiver at other times during the day when the person is better mentally able to handle it, and the box does its purpose of just reminding them. It's not just the pill taking that's a comfort factor of the box. It's also the fact that effectively it is double checking on the person in the home repeatedly during the day. I mean, you can get a Lifeline personal help button or something like that, but that assumes that they're wearing the button, and it assumes that they can reach the button. But with this, you know that at noon, at 4, at 9 p.m., they got up and they went into that room and they took the pill, and you can document they did that. If they didn't take the pill, you also know that there's some issue that needs to be explored either by you or somebody who's close by or whatever. I think the price is very fair. I mean, it basically works to $1 a day, and the cost of not having it is many times higher than that. You take what happens if somebody doesn't take a pill, they suffer vertigo, they fall, they break something. What kind of cost are you talking about in that situation? Well, obviously many thousands. So to spend a less than the price of a burger at McDonald's, you can solve that issue. I think that's a good price point. I think there are a variety of benefits for this product with home care agencies. First of all, it leverages your caregivers. Effectively, with this box, you can be with your client a lot longer and yet not have a caregiver having to sit there and watch for the pill. So where it might not be cost effective either for you or the client to send somebody in for half an hour to make sure somebody takes their evening pill, with this box we can monitor that, we can see it happens. We can also point out issues to the families. With the data from the box on the web page, we can go to the family and say, okay, here we have a clear issue in the morning, we're there in the afternoon, let's change our scheduling to accommodate this clear issue. And there's not going to be an argument about it because you've got the documentation to show it. I also think that it shows that you are technologically using and bringing the latest tools to your clients. Families these days are very interconnected, they're on cell phones, they're on the web. They like to think that the people who are providing the service are also bringing the latest in technologies, assuming it benefits the clients, and in this case it clearly does, to introduce them to it, and that's what this does. I think the installation process was very straightforward. It's always intimidating when you have a new piece of technology, no matter what it is. I don't care if it's a telephone, I don't care if it's a light switch, but when you first see it, you say, oh my God, I've never seen anything like this before. But then when you actually do it, you say, oh, wait a minute, this does make sense. And let's take as an example the fact that you have to type in the medications and the dosages and all of that kind of thing and put that on a sheet. Well, you know what, that actually turns out to be a huge benefit when you're actually filling the pill box, because you've now got a clear printout. Before, this particular client that I'm thinking of had these scribble notes all over the place, and it was impossible to figure out what pills they should be taking at what times. Now we've got a nice, clean, printed out record. I printed out the thing off the web page and I stuck it in his medical file that he takes to his doctor. So now he's got a report of all the medications he's taking. It's clear, it's easy to understand, and anybody involved in his care who has access to MedMinder page can see that. So yes, you have to make a small, and by small I think it maybe took me 15 minutes to get his multiple medications typed into the system, but that's a very small investment for the future benefits that you're going to accrue from having that.